Incidence of PCOS is increasing in the recent past and is the most common diagnosis in the adolescent girls and women of reproductive age group. As we all know, PCOS is a lifestyle disease and there is no cure for this other than symptomatic treatment like a regularization of menstrual cycles with a hormone treatment, hair removal for excess hair growth, and treating acne. Being a disease with long-term implications on fertility and general health of the individual, it's very important to identify polycystic ovarian syndrome in the initial stage and take steps to stop the progress of the disease. If we doctors are able to diagnose the cases early and motivate the patient and caretakers of the adolescent girls to correct the lifestyle in the initial phase itself, we can prevent reproductive problems and an array of diseases like diabetes, hypertension, elevated cholesterol, fatty liver, thyroid problems, cancer uterus, etc. in future, which will compromise the quality of life of the individual. Excess weight gain, more specifically, excess fat accumulation in the body may be the first sign of PCOS, followed by irregular or prolonged menstrual bleeding, excess male pattern hair growth on the face and body, hair loss from the scalp, and acne. If such symptoms are noticed, immediate effort to be taken to stop disease progress and reverse the pathology. Hormonal changes and inflammation associated with the excess fat accumulation in the body is the root cause of PCOS. Inflammation in the production of imbalance in the production of female hormones, estrogen and progesterone, basically an excess of estrogen and deficiency of progesterone associated with the absent or delayed ovulation is the reason for irregular or prolonged menstrual bleeding and reduced fertility. Excess male hormone production leads to male pattern hair growth and hair thinning on scalp. PCOS is primarily a lifestyle disorder associated with a sedentary life and high-calorie, nutrient-deficient diet. Optimization of health with the cell activation support will stop the progress of the disease and reverse the pathology. Burning out the excess fat stored in the body and correcting the body lean mass to fat mass ratio and correcting the omega-3 to 6 ratio with the cell activation support will help to preserve fertility and prevent progress to metabolic syndrome and associated health issues. In PCOS patients, excess fat in the body acts as an overgrown endocrine gland, initiating hormonal imbalance and inflammatory diseases. If the excess fat is in the form of inflammation inducing trans fat and omega-6 fat, health issues will be more intense, leading to diabetes, autoimmune diseases, and allergic disorders. Obese PCOS adolescent children are prone for emotional trauma and depression due to bullying from peers and discrimination in society and even in family. Cell activation program for PCOS is basically a clinically monitored and supported lifestyle correction program. It is not possible to correct the aberrant food habits and sedentary lifestyle of the PCOS children without the full hearted support and involvement of the parents. With the CAP support, one can reduce 10 to 20% weight within 3 months, regularize menstrual cycle, reduction in acne, reduce excess hair growth, and stop hair thinning, and help in regrowth of the hair. In women trying for pregnancy or on infertility treatment, CAP will help to achieve pregnancy and prevent pregnancy complications like abortion, gestational diabetes, hypertension, preterm labor, etc. In growing children, many a time much weight reduction is not needed, but to see that no further weight increase till the ideal height for weight is achieved. There are no drug or surgery involved in CAM, so there are no side effects or complications and safe for adolescent children. While controlling weight gain, optimized nutrient composition and Oxyflex will ensure optimal physical, intellectual and emotional growth of the child.